Osteoarthritis is fairly prevalent or common in the great toe. Probably 1 in 40 people over the age of 40 have it. It's a condition of wear and tear where you lose your cartilage. And once you lose your cartilage, you have these bald spots of bone exposed. They have nerve fibers. Your bone is actually like a living coral reef. And the nerve fibers cause the pain, and you also get inflammation. If someone has arthritis in their great toe and it bothers them, they should seek consultation with a qualified foot and ankle surgeon and consider non-operative measures first. And if that fails and they're not happy, then they think about the surgical options. Traditionally, the gold standard was the fusion. We weld the ball and socket together in a proper position. You can still move the tip of your toe, but the great toe at the junction further back, about 1 inch back, doesn't move. Something newer in this country for the last 3 years is the Cartiva. The Cartiva implant is almost the shape of a pencil eraser, and it's made out of a substance called polyvinyl alcohol. It has the same modularity and feeling as cartilage, and it has a little cushion effect. It's almost like a brake pad. We put it on the ball side of the joint. There's a ball and a socket, and the ball and socket are both arthritic, mostly the ball. So we have this little plug there, and we keep it about 2.5 millimeters proud, so the socket goes over the Cartiva rather than the raw bone, and it's less painful. A couple of things will make the Cartiva implant, or resurfacing as we call it, different from the other option of fusion. One is you still have the mobility. So for certain people, they want to do things like dance and yoga and wear higher heels, so this gives them the ability to, but also it's a less invasive procedure. The Cartiva recovery is half the time of the fusion because the incision is about half the size. It's for pain relief, but they'll still have some pain. The socket still has some arthritis in it. So it's a matter of being patient, understanding it might even take up to a year to be where they want to be with this. You have to look at the pros and cons and what the patient's desires are and what kind of outcomes they want.